This is a short film to help families and carers of children with a learning disability aged 0 to 5 years old understand their rights when they attend hospital. At this stage, your child is still developing and you are still discovering what is most important for you and your child.
My name is Kawa and this is my son Kamal. When we go to hospital, Kamal may need extra help to feel safe and comfortable or to understand what is happening.
What's over there?
These small changes mean he should get equal healthcare and are called reasonable adjustments.
It is a parent's right to ask for a reasonable adjustment, and it is important that children receive reasonable adjustments in hospital at every stage of their lives.
What are we doing here?
This is the learning disability nurse at our local hospital. Some people may not have a learning disability nurse in the children's department at their hospital.
If you don't have one, then you can talk to your learning disability team for support or speak to the paediatric matron. Every trust works differently.
Kamal has to go to hospital soon. I can tell he is scared.
I'll be going soon, Dad.
Lots of hospitals can arrange for you both to visit before and to look around. You can both ask questions and look at the ward and the equipment.
What's in there?
Whoa, what are you doing?
Kamal doesn't like noise or busy places like accident and emergency.
You can ask for a quiet room.
Dad!
He also doesn't like waiting.
You can ask for the first appointment of the day or for one when we're less busy. Is there anything else we can do to help? Oh, hello, Dr. Khan.
Everybody needs different things, but these are the things that help my son and me. Listen to our feelings about things. Read my son's hospital passport. The hospital passport has information about the child or adult with a learning disability. This should help them to get the support they need.
Can we go now?
I can tell Kamal feels better when people have read his notes as they speak to him in the right way and appear to know his abilities, condition, and what reasonable adjustments might help. Keeping the same staff around him as much as possible helps Kamal. He doesn't like change and this helps him to build up trust.
Children with a learning disability may show pain or discomfort differently. Kamal's doctors might not understand this and may ignore his symptoms and think they are because of his disability when they are not. This is called diagnostic overshadowing. Kawa knows his son better than the doctor. Kawa may have to explain this to the doctor and ask him to communicate clearly and listen carefully to Kamal. That was a lot of stuff to remember, so here is a quick reminder. Making small changes to the way your child is supported in hospital can make them feel happier and are called reasonable adjustments. It is your right as a parent or carer to ask about reasonable adjustments. There are usually extra people who can help, like a learning disability nurse or someone from your local learning disability team or paediatric matron. Some hospitals may have special measures in place because of COVID-19, and this may affect what reasonable adjustments hospitals can make during the pandemic. For example, instead of visiting the hospital beforehand, a virtual tour could possibly be provided, or a chat with a professional who is supporting you through the process. This film has been made in partnership with Mencap and Bradford People First. Thanks must go to BTM, who developed and produced this animation, and Airedale Hospital for their involvement and support. Thank you for watching.